Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is September 22nd, 2025. This video is on a Lancet article published on September 20th, 2025, titled Effect of Evolocumab on SVG Patency after CABG, the NEWTON-CABG Cardio Link 5, an international randomized double-blind placebo-controlled trial. There was an accompanying commentary or editorial titled Evolocumab for Prevention of CABG Failure. Timing is everything. SVG or saphenous vein graft failure remains common post-CABG with up to 40% occluded by 10 years. LDL cholesterol lowering reduces atherosclerotic cardiovascular disease, but its role in SVG failure is unclear. Evolocumab, a PCSK9 inhibitor, substantially lowers LDL cholesterol and regresses arterial plaques. Its role in SVG patency had not been previously tested in randomized controlled trials. This is an international multi-center double-blind randomized placebo-controlled trial across 23 sites in US, Canada, Hungary, and Australia. Study cohort comprised of 782 patients, 389 Evolocumab, 393 placebo, with a modified intention to treat analysis on 554 participants. Randomization: within 21 days of CABG, all patients were on moderate to high intensity statin therapy. The primary endpoint, SVG disease rate, equal to or greater than 50% occlusion at 24 months on CT angio, coronary CT angio, or invasive angio. Stats randomized, stats generalized estimating equation model. Logistic regression was utilized. P-value less than 0.05 considered significant. What did they find? Evolocumab reduced LDL cholesterol by 48.4% versus placebo at 24 months. 24-month SVG disease, 21.7% in the Evolocumab group versus 19.7% in the placebo group. Difference to 2%, p-value 0.44. No significant decrease in secondary endpoints, which include complete SVG occlusion, MACE, and revascularization. Limitations: short 24-month follow-up, underpowered for clinical events. Baseline LDL cholesterol was already low. Small absolute LDL cholesterol difference. COVID-19 disruptions limited baseline imaging and added missing data. Key takeaways: intensive LDL cholesterol lowering with Evolocumab did not significantly reduce saphenous vein graft disease. Early saphenous vein graft failure is mechanistically distinct from native atherosclerosis. New strategies beyond lipid lowering, targeting thrombosis or graft remodeling, are needed. There was an accompanying commentary which said, timing is everything in CABG failure. Early SVG, saphenous vein graft failure, is driven more by thrombosis and myointimal hyperplasia than atherosclerosis. Evolocumab was tested during this early phase when atherosclerotic burden is still minimal, potentially underestimating benefit. The trial critique: 29% of the patients lacked imaging follow-up, possibly biasing the results by excluding higher risk individuals. No effect at 2 years does not negate potential long-term benefits as atherosclerosis becomes predominant in later years. Clinical message: as per the editorialist, secondary prevention with lipid lowering remains crucial post-CABG. Future trials should focus on long-term, that is greater than 5 years, impact of PCSK9 inhibitors in vein graft preservation. Strategic timing on lipid lowering interventions is vital for clinical efficacy and graft durability. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom.